In the world of weight loss and diabetes management, Ozempic has been making headlines, but not just for its primary uses. Recently, women using Ozempic and similar GLP-1 receptor agonists have taken to social media to share an unexpected side effect: surprise pregnancies. This phenomenon, now referred to as Ozempic babies, has sparked a mix of hope and caution among medical professionals. The emergence of a surprising trend. Social media platforms are buzzing with stories from women who attribute their unplanned pregnancies to the use of Ozempic. A Facebook group named I Got Pregnant on Ozempic boasts over 600 members, while numerous Reddit threads and TikTok videos discuss this unexpected outcome. According to the Washington Post, this trend has intrigued the medical community, prompting discussions about its implications for fertility treatments. However, the reports are primarily anecdotal, and the actual prevalence of this phenomenon remains unclear. Understanding the connection. Doctors and researchers are still trying to understand why these unplanned pregnancies are occurring among Ozempic users. Laura Shaheen, a reproductive endocrinologist, explained that significant weight loss can affect ovulation and fertility. Weight loss, along with the balancing of hormones and improved insulin resistance, can cause the hormonal system to function more efficiently, potentially leading to the resumption of ovulation in women who previously experienced irregular cycles. Another hypothesis is that GLP-1 drugs like Ozempic may interfere with the effectiveness of oral contraceptives. These drugs work by curbing appetite and slowing gastric emptying, which might affect how the body absorbs medications, including birth control pills. William Dietz, a physician and chair of the Stop Obesity Alliance at the Milken Institute School of Public Health at George Washington University, suggested that this interaction could render oral contraceptives less effective, increasing the risk of unplanned pregnancies. Medical community's mixed reactions. The rise of Ozempic babies has led to a split in the medical community. Some doctors see this trend as a potential breakthrough for treating infertility, especially in conditions like polycystic ovary syndrome, PCOS, a leading cause of infertility in women. The off-label use of GLP-1 drugs for PCOS is becoming more common, as there are currently no approved medications specifically for this condition. The success stories are compelling, but they come with significant caveats. For instance, a study analyzing the health records of 50,000 women with type 2 diabetes found no increase in congenital disabilities among infants born to women who took semaglutide during early pregnancy compared to those who took insulin. Despite these findings, experts agree that more research is needed, particularly involving women without diabetes. The lack of comprehensive data leaves many questions unanswered, causing hesitation among some doctors. Concerns over safety and ethical implications. While the idea of using GLP-1 drugs to treat infertility is appealing, it also raises ethical and safety concerns. Studies on animals have shown increased rates of congenital disabilities in pregnant rats, rabbits, and monkeys given semaglutide, the active ingredient in Ozempic. These findings are alarming and suggest that the drug might pose risks to human pregnancies as well. Melanie Cree, director of the PCOS clinic at Children's Hospital Colorado, expressed excitement over the potential benefits of GLP-1 drugs, but also emphasized the need for caution. The oops babies on Ozempic and Wegovy are happening all over the place, she told Bloomberg. This trend, while promising, is also a bit scary because we're moving forward without all the data. Novo Nordisk, the company behind Ozempic and Wegovy, is currently collecting data to evaluate the likelihood of pregnancy while using these drugs. However, they have made it clear that pregnancy and the intention to become pregnant were exclusion criteria in their clinical trials. This means that the available data does not adequately address the drug's impact on fertility and pregnancy, leaving a significant gap in knowledge. The path forward. As the medical community grapples with this unexpected development, it is crucial to proceed with caution. More rigorous and comprehensive studies are needed to understand the full implications of using GLP-1 drugs like Ozempic for weight loss and potential fertility treatments. In the meantime, healthcare providers should advise their patients on the potential risks and ensure that those using these medications are aware of the possibility of reduced effectiveness of oral contraceptives. For now, the stories of Ozempic babies serve as a reminder of the complex and often unpredictable nature of medical treatments. While these drugs offer significant benefits for weight loss and diabetes management, their full impact on fertility and pregnancy remains to be seen. Until more data is available, both doctors and patients must navigate this new landscape with informed caution.